Hi friends, good evening and welcome to my channel Mugambika Nursing. Friends, in today's video we can discuss some important terms from integumentary system. These points will helpful for your exam as well as interviews. We will see the points. Firstly, we will see the points from primary lesions. Primary lesions is the first lesion to appear on the skin. Okay, so first one is macule. Macule is a skin color change without elevation. Here in the picture, we can see what is macule. There is a flat color changes. That is first color changes occurring in the body, that is known as macule. The next point is papule. Papule is an elevated solid lesions of less than 1 centimeter in size and varying in color like warts. Warts means it is black in color, or like nevus, it is red in color. Okay, it is an elevated solid lesion and less than 1 centimeter in size. Its diameter is less than 1 centimeter. It's an elevated or raised solid lesions, that is known as papule. And the next point is plaque. Plaque is a raised flat lesions formed from merging papule or nodule. From the papule, again it is forming a flat lesion, that is known as plaque. First one, macule. Macule is a skin color change and papule is a solid lesion. Plaque which is merging from the papule. Okay. And the next point, nodules. A larger than a papules, raised solid lesions extending deeper into the dermis. Okay, it is larger than papule. Papule is a solid lesion which is less than 1 centimeter in size. Here the nodule is, it is larger than papule. It is more than 1 centimeter in diameter and it is raised solid lesions. And it is extend deeper into the dermis. So, it goes deeply into the dermis layer of the skin. A large nodule is referred as a tumor. Next is wheal or hive. This is a fleeting skin elevation that is irregularly shaped because of edema. For example, urticaria or mosquito bite. Here the skin elevation is just like itching, that is urticaria or mosquito bite. During the time of mosquito bite, there is a small patches are coming in the body. That is known as wheal or hives. And next one, vesicles or blister. This is an elevated, sharply defined lesion containing serous fluid, usually less than 1 centimeter. For example, blister like in chicken pox and all. In blisters, there is a sharply elevated lesions which contain fluid-filled lesions. Fluid-filled lesions are known as blisters or vesicles. It is less than 1 centimeter in diameter. The next one is bulla. Bulla is a large, elevated, fluid-filled lesions greater than 1 centimeter. Vesicle means it's also a sharply elevated lesions containing serous fluid and is less than 1 centimeter in diameter. Here bulla is a large elevated lesions like burns and all. If burns and all is a the lesions are big, it's contain fluid filled lesion, that is known as bulla. And cyst. Cyst is also elevated thick walled lesion containing fluid or semi-solid matter. Okay, that is known as cyst. The next point is pustules. These are elevated lesions less than 1 centimeter containing purulent material. Okay, so this is also a lesion which is small in size and containing pus forming material, that is known as pustule. And the lesions larger than 1 centimeter are described as boils or abscess or furuncle. If it is the pustule is bigger means that is known as boils or abscess or furuncles. Okay, this is a lesions with purulent material, that is known as pustule. These are all some primary lesions which is occurring in the body. And next point is scale. This is a dried fragments of sloughed epidermal cells. irregular in shape and size, and white, yellow, or silver in color. The dried fragments of epidermal cells are known as scale. For example, dandruff and also dry skin. Some person is having dry skin, that is also example of scale, and the skin in psoriasis, all examples. Next is known as crust. Crust is a dried serum, sebum, or blood or pus on skin surfaces, producing a temporary barrier to the environment. Crust is forming around the injured area, that is during the time of any injury, or if the blisters will become burst, that form the blood or the secretions will form a barrier around the injured area, that is known as crust. The next is erosions. Erosion means a moist, demaciated, depressed area due to loss of partial or full thickness epidermis. Due to the loss of epidermis or the skin around the lesion, that cause erosion. The next point is ulcer. Ulcer is irregular shaped exudative depressed lesions in which entire epidermis and all or part of dermis are lost. Here ulcer, as we all know, for example, pressure ulcer or decubitus ulcer. In these lesions are irregular shaped and the dermis or epidermis will be lost. That is known as ulcer. Ulcer is an irregular shaped exudative depressive lesion. And the next point is scar. Scar means mark left on the skin after healing. So after fully healing the lesion, there is a mark left on the skin, that is known as scar. Lignification is an epidermal thickening resulting in elevated plaque with accentuated skin marking. For example, due to repeated injury through rubbing or scratches. Lignification is one of the epidermal thickening. For example, during my duty time, I saw that this depressive patient or drug addict patient, what they will do, they will continuously do marking on the skin. Once the injury will heal, that form a thickened marking on the injured area, that is known as lichenification due to repeated injury through rubbing or scratches. Okay, it's an epidermal thickening resulting in elevated plaque with accentuated skin marking, that is known as lichenification. And the next point is excoriation. Excoriation is an superficial linear abrasions of the skin. This is one of the aberration, small aberration, scratching of the skin is known as excoriation. And next is fissure. Fissure is a deep linear split through epidermis into dermis. For example, tinea pedis during the time of winter season and all foot tear will come. That is known as fissure, deep linear split through epidermis into dermis. The next point is atropy. Atropy is wasting of epidermis in which skin appears thin and transparent. That is due to the degeneration of the epidermis or destruction of the epidermal layer cause thin and transparent skin. That is known as atropy. These are some important terms which I selected from the integumentary system. This will helpful for your exam. Absolutely, it will helpful for your exam.